Welcome to the Endocrine Matters podcast. This podcast episode is sponsored by Complete Medicine and Hey Healthy. Today, I want to talk about something that comes up more than you might expect in my endocrinology practice: iodine supplementation. Specifically, whether women in the US actually need it for thyroid health. And the short answer is, most of us don't. But I've seen real patients harmed by taking it unnecessarily, so it's worth understanding why. I've had patients come to me who develop both hypothyroidism and hyperthyroidism from iodine supplements, conditions that fully resolve once they stop taking them. Some of those same patients had been told by other practitioners that they needed an extensive workup. One was even told she needed a thyroidectomy or surgery to remove her thyroid because of a problem that was caused entirely by a supplement another provider had sold her. I wish that was a rare thing, but it's something that I've seen with my own patients. So today, I want to give you the information you need to understand what iodine actually does, why most American women don't need a supplement, what the real risks of oversupplementation are, and what to watch out for on supplement labels. I'm Dr. Thangudu, and this is Endocrine Matters. Let's start with some grounding facts. The United States as a whole is considered iodine sufficient. That's the official assessment based on national surveillance data, what we call NHANES, the National Health and Nutrition Examination Survey. So at a population level, we are not in a crisis of iodine deficiency the way some parts of the world are. But, and this is a big but, that population level sufficiency doesn't tell the whole story. The bottom line, most American women are getting enough iodine. If you eat a reasonably varied diet, some dairy, eggs, seafood, or iodized salt, you are almost certainly fine. This is not something you need to be anxious about or actively testing for. So where does iodine actually come from in the American diet? Well, dairy is a big one, not because milk is naturally rich in iodine, but because of cattle feed and disinfectants used in the dairy industry. Seafood, eggs, and iodized salt are also meaningful sources. If you're eating a varied diet that includes any of these, you're probably in really good shape as far as iodine is concerned. Even if you don't use iodized salt at home, you're likely getting iodine from other sources or restaurant foods, which use large quantities of salt in production. The average American is not walking around iodine deficient. That's just not the reality of our food environment. Now, there is one group where iodine genuinely warrants attention: pregnant and breastfeeding women. The fetal brain needs thyroid hormone, which needs iodine, and the demand goes up during pregnancy. The recommendation there is simple: take a prenatal vitamin that contains 150 micrograms of iodine. That's it. You don't need a kelp supplement or a high-dose iodine protocol, just a standard prenatal. Most women who are eating reasonably and taking a prenatal are completely covered. So let's talk about testing, because I know some of you are already thinking, okay, but how do I know if I'm deficient? Can't I just get a test? And here's my honest answer: no, and you shouldn't really want one. Not because the test is dangerous, but because it genuinely can't tell you what you think it can, and acting on it can lead you somewhere harmful. Spot urinary iodine testing is a population surveillance tool. It was designed to monitor the iodine status of entire countries, not individual patients. The American Thyroid Association is pretty explicit. A single spot urine iodine or even a 24-hour collection cannot reliably tell you whether you specifically are iodine deficient. Why? Because what you ate yesterday or even this morning will dramatically change your result. Iodine is excreted rapidly and variably. One test at one moment in time is essentially meaningless for clinical decision-making when it comes to iodine. So when a wellness practitioner orders a spot urine iodine, gets a low number, and tells you that you're deficient and need a supplement, that is not evidence-based medicine. That is a test being used outside of its intended purpose, and it can lead you towards supplementation that you don't need and that can hurt you. Your TSH and your thyroid hormone levels also cannot tell us whether you're iodine deficient. They screen for thyroid disease, not nutritional status. Perhaps we have some emerging biomarkers that can help us with iodine assessment, but they're not ready for clinical use yet. So the bottom line, if you're eating a varied diet and you're not pregnant, There is no validated, reliable test that can tell you if you're iodine deficient as an individual, and you should be skeptical of anyone who claims otherwise. Now let's talk about the part that almost nobody tells you, and why this matters so much for women with thyroid disease specifically. Iodine is not a benign supplement you can take liberally. Too much iodine can actually cause both hypothyroidism and hyperthyroidism. This isn't theoretical. I've seen it happen in my own patients. And the tricky part is that when it does happen, it can look exactly like thyroid disease that needs aggressive treatment. One of my patients was told she needed a thyroidectomy. The real culprit was the iodine supplement she'd been put on. Here's something that puts iodine's power into perspective. In hospitals, we actually use iodine intentionally to suppress the thyroid before surgery. When a patient has severe florid hyperthyroidism and needs a thyroidectomy urgently, we give them high-dose iodine in the days before the procedure to decrease blood flow to the thyroid and make the surgery safer. That's a deliberate, controlled, short-term medical use. It illustrates just how potent iodine's effect on the thyroid can be, and why taking it casually as a supplement is not without consequence. So how does this happen physiologically? Let me walk you through two mechanisms in plain language. The first is called the Wolff-Chaikoff effect. When the thyroid is suddenly flooded with excess iodine, it responds by shutting down thyroid hormone production, almost like a circuit breaker tripping. In most healthy people, the thyroid adapts within a week or two and hormone production resumes normally. But in people with underlying thyroid conditions like Hashimoto's, prior radioactive iodine treatment, partial thyroid removal, that adaptation often doesn't happen. The thyroid stays suppressed, and the result is hypothyroidism that persists as long as the iodine load continues. The second is called the Jode-Basedal phenomenon, essentially the opposite problem. In someone with autonomous thyroid nodules or latent Graves' disease, a surge of iodine can cause those nodules to go into overdrive and produce excess thyroid hormone. The result is iodine-induced hyperthyroidism, which can be serious, especially in older women with underlying heart conditions, for example. Excess iodine can also trigger or worsen autoimmune thyroiditis. If you have Hashimoto's or elevated antibodies, iodine excess can accelerate progression of hypothyroidism. Now here's what I really want you to take away from this section. Look at the labels of thyroid supplements. There are a lot of products marketed specifically for thyroid health, and many of them contain very high doses of iodine, or kelp, which is an extremely concentrated natural source of iodine with highly variable content. These are not gentle, supportive supplements. They are delivering pharmacological doses of iodine to people who often already have thyroid conditions and are exactly the population most at risk for the effects I just described. Some of these products go well beyond the tolerable upper limit for iodine in adults. Here's a practical takeaway, and I want you to exhale when you hear this. If you are a non-pregnant woman living in the United States and eating a reasonably varied diet, you almost certainly do not need an iodine supplement. You do not need an iodine test, and you do not need to be worried about your thyroid missing out on iodine. What you do need to be cautious about is the opposite, taking iodine supplements that you don't need, especially high-dose ones, because that is where the real risk lives for people with thyroid conditions. If you are pregnant or planning to become pregnant, take a prenatal vitamin with 150 micrograms listed on its label. Check the label though. That's one concrete action item from this episode. For everyone else, eat real food. Dairy, eggs, seafood, and iodized salt are all good sources of iodine. You don't need to obsess over it. If you have Hashimoto's, Graves' disease, thyroid nodules, or a history of thyroid treatment, be especially cautious about any iodine supplement and have that conversation with the thyroid specialist before you start anything. And if a practitioner is pushing iodine testing or high-dose iodine supplementation on you without a clear clinical reason, that's a red flag. You deserve care that's grounded in evidence, not in supplement sales. I want to leave you with this. You don't need to be afraid of iodine deficiency if you're living in the United States and eating real food. That fear, and the testing and supplementation that comes with it, is being manufactured, often by people who profit from your anxiety about your health. What you do need is accurate information. A thyroid specialist who understands that iodine excess is a real and underappreciated risk for women with thyroid conditions, and the confidence to push back when someone tries to sell you a test or a supplement that you don't need. That's what this podcast is for, cutting through the noise, giving you real information so you can show up to your appointments informed, ask better questions, and advocate for care that's actually grounded in evidence. If this episode helped you clarify something you've been confused about, please share it, especially with women you know who are navigating thyroid disease. Leave a review if you can, and find me in the show notes if you want to learn more about working with me directly. I'm Dr. Thangudu, and this is Endocrine Matters. Until next time, eat well, skip the unnecessary supplements, and remember, normal is actually okay.